Spinal stenosis can occur in any spinal area, cervical, thoracic, or lumbar. It's most common in the cervical and lumbar spines, especially with aging and the degenerative spinal conditions, because those are the areas that see the most mobility. In particular, lumbar spinal stenosis is what often presents with the leg pain that is accompanied by a history of inability to stand or walk distances, and patients find that if they sit down, oftentimes their pain improves. When cervical spine is affected by stenosis, that can present in a different presentation because the spinal cord, when it's compressed, can cause symptoms of myelopathy. And so that may not present as lower extremity pain, it may present as clumsiness, gait disturbances, balance disturbances, and can present with both upper and lower extremity findings. So when we talk about treatment options, patients can benefit from spinal injections, which may provide some improvement symptomatically, allowing them to be more functional. From a surgical standpoint, depending on the complexity of an individual situation, options may include simply opening the space up, something we refer to as a surgical laminectomy or decompression, but it may also involve having to stabilize the segment by fusing or placing screws and rods to make sure that there's no abnormal motion at that segment. These are options that really will vary depending on individual patient imaging findings and clinical presentation.